Assurance is a function of public health involves enforcement of legislation that was put in place by policymakers. This assures that the necessary services needed by the public are being utilized to achieve the goals that were set by the local, state, and/or federal policymakers. Assurance is instrumental in addressing community issues like poverty and the health disparities through programs that will normally fall under the Department of Family and Children Services, depending on where you reside. However, Medicaid, food stamps, WIC, child support, preventive health, and immunization programs and services can fall under one agency, such as DFACS. Qualified and trained professionals are essential to the assurance process because it is important to the individuals and communities where these services are needed and for overall public health. If an agency is dysfunctional in any area of operations, it will reflect in the customer service. That is why periodic evaluations is done by public health officials and policymakers to ensure implementation of public health programs are meeting the initial intent and overall goals within the low-income or poverty-stricken communities. The enforcement of laws and regulations are very essential to environmental health and safety. The Environment Protection Agency has its policy and procedures, but the state, county, and local health-related rules and ordinances are equally enforced to ensure the safety of the residents of the states. Childhood and family poverty has much to do in the face of childhood neglect and abuse. According to the U.S. Department of Health and Human Services, since the late 1970s, the Child Abuse and Neglect User Manual series has provided guidance on child protection to hundreds of thousands of interdisciplinary professionals and concerned community members. The User Manual series provides a foundation for understanding child maltreatment and the roles and responsibilities of various practitioners in its prevention, identification, investigation, assessment, and treatment. Legal intervention is sometimes necessary to ensure the safety of the neglected child and to bring about the needed changes in the family. Formal confrontation in the court of the family's failure to meet minimally adequate standards of care may create the tension necessary to move the family towards providing adequate care for the children. According to SIM, admitting to poverty is a sensitive issue and many children may not perceive themselves as being poor. Research indicates that the P words, poverty and poor, are often experienced as stigmatizing labels and are rarely used by people living in deprivation themselves. In this author's opinion, it is not until someone points something out to you that you truly feel it. I have lived most of my life with little money, yet I have a wonderful family and feel rich. Children living in the southern United States, namely Mississippi, do not feel impoverished either until someone points it out. According to the National Congress of State Legislators, all 50 states, the District of Columbia, American Samoa, Guam, the Northern Mariana Islands, Puerto Rico, the U.S., and Virgin Islands have laws and policies that specify procedures for making and responding to reports of suspected child abuse or neglect. Mandated reporters are required by most states to make an immediate report when they suspect or know of an abusive or neglectful situations. In Mississippi, it is a misdemeanor not to report suspected child abuse and neglect, as well as the good as faith of the reporter is assumed unless it could be proven to the contrary. Also in Mississippi, mandated reporter is required to submit their name and contact information along with a written report after he or she has made an oral report. If the reporting person does not want to report their name, they could be compelled to do so by court order. As public health officials, we cannot assume that adults know where to go to get the services they need for themselves, but especially for their children. Public and community health departments are essential to linking people with much need services to assist and improve the well-being of poverty-stricken individuals and communities. Just because a child is living in poverty does not mean that they have to go without the required preventative health care, checkups, and immunizations, which ensures that they are meeting the requirements to attend public schools as well. The 10th function of the core functions of public health is the evaluation process. All programs and services offered through the Public Health Department should be evaluated on a regular basis, usually annually, to assure the programs and services is meeting its intent. The assurance process may include research for new solutions, processes, and programs offered by other organizations that may be beneficial to the prospective communities in which other services are needed to ensure the health needs of the community and public are being met accordingly. The Mississippi State Department of Health and other public health agencies nationwide balance three core government public health functions. These functions are essential to the maintenance of population-based services. Number 1, public health agencies access community health status and whether the community has adequate resources to address the problems identified. Number 2, use the data gathered through assessment to develop health policy and recommend programs to carry out those health policies. Number 3, assure that necessary high-quality, effective services are available. This includes a responsibility for quality assurance through licensing and other mechanisms. Assure does not always mean provide. The government public health agency must see the services available to people who need them. The Office of Epidemiology carefully watches occurrences and trends of reportable diseases, investigates outbreaks of diseases, helps interrupt outbreaks or disease problems, and reports morbidity and trends to the medical community and other target publics. The epidemiology staff in Mississippi reported approximately 20,000 cases of reportable diseases. Reported cases included diseases such as brucellosis, encephalitis, E. coli, hepatitis, leptospirosis, lymph disease, malaria, meningitis, salmonella, rabies, to name a few. All areas of the assurance process are important to the overall process of ensuring public health, but having an educated, trained, certified, qualified, experienced, and/or licensed staff is critical to the public health. It is imperative that the professional staff stay trained up on the new healthcare laws and technological health advance to operate as efficiently as possible. The Division of Health Promotion, Education, Chronic Disease provides and supports services aimed at school, community health, and worksite programs in order to improve the health of Mississippians. Health educators work within the community, groups, schools, and clinics to implement the health promotion programs. Immunization program staff strive to abolish morbidity and mortality from vaccine-preventable diseases by working with federal and state agencies, local health departments, physicians, and other private immunization providers, schools, hospitals, nursing homes, licensed child care facilities, community-based organizations. In 1999, Mississippi reported 36 cases of hepatitis A, 7 cases of pertussis, aka whooping cough, 6 cases of mumps, and no cases of measles, diphtheria, or polio. The Tuberculosis Control Program provides early and rapid detection of individuals with or at risk of developing tuberculosis. Mississippi is among the highest states for incidence of TB, continue to exceed the national average with 8.2 cases per 100,000 people in 1998. Children who are particularly vulnerable to rapid progression of the disease represented 8.0% of Mississippi's TB cases. Tuberculosis in children is a sentinel event demonstrating ongoing transmission of TB disease in the community. To provide the opportunity for more rapid intervention, the Mississippi State Board of Health made TB infection in children under the age of 15 a Class I reportable condition. Personal health services provide well and sick child services at or below 185% of the poverty. Services are preventive, however, treatment is often included for those who need the greatest. Using the multidisciplinary team approach, including medical, nursing, nutrition, and social work, the Child Health Program provides childhood immunizations, well child assessment, limited sick child care, and tracking of infants and other high-risk children. Children needing further care are connected with other state Department of Health programs and/or private care providers necessary for effective treatment and management. This guarantees cost-effective services which are acceptable to patients, promote good health, prevent occurrence of or progression of illness and disability, and restore the function damaged child. The Child Health Program served 73,307 children in 1999. Public health dentistry targets toward improving the oral health of Mississippi children and their family. The Dental Corrections Program aims to provide financial assistance to families with children with limited access to dental care. Weekly School Fluoride Mouth Rinse program helps prevent tooth decay, which can reverse the decay already started. The schools who participate with the program are given the supplies and tropical flora needed at the beginning of the school year. The program is recommended for children from kindergarten through 5th grade. The Mississippi State Department of Health take care of their children very serious to provide the best quality care, prevention, and intervention for their children. In conclusion, today's child living in southern United States, namely in states such as Mississippi, have it rough. Down south, poverty and health disparities seem to run rampant. 1 out of every 4 children living in the United States will go to bed hungry tonight or get very sick because they do not have the basic necessities to keep them warm. Perhaps they are homeless, or just as bad, if their family has a home, they cannot afford electricity and heat. Poverty contributes to poor medical and mental health. Some behavioral problems may include impulsiveness, aggression, attention deficit, hyperactivity disorder, and low self-esteem. Public health care workers promote physical and mental health and prevent disease, injury, and disability. Their primary function is to focus on the population, including the poor and low-income families. Many policy approaches focus on poverty, equity, or human rights in relation to health and have sometimes been viewed as conflicting or competing against the rich and the poor. There are millions of policies that organizations have formed to make childhood poverty decrease over time, but large disparities in health persist within the United States. Child poverty is a problem that will not go away anytime soon. Many communities partner together to keep the local kids involved off the streets and safe from drugs and danger. All the key essentials are there daily to help with the system, and many changing policies that are being revised daily. Assurance is instrumental in addressing community issues like poverty and the health disparities through programs that will normally fall under the Department of Family and Children Services. We have a long way to go to help those children in need. Whether they live in the northeast, east, west, or southern United States, always keep in mind it takes a village to raise a child. In other words, no one is truly alone in this world if they keep their hearts and minds open. Let's always be there for one another and wipe out childhood poverty in their lifetime.